Hello, my name is Andrea Salinas, and this year I conducted a research project about medical professionals versus their mental health during the COVID-19 pandemic. The purpose of my study is to see if medical professionals' mental health has been affected by the COVID-19 pandemic. Medical professionals have been under large amounts of stress due to the influx of hospitalizations due to COVID-19. Based on that information, I had two research questions that I wanted to incorporate into my study. And I wanted to see essentially which mental illnesses were more prevalent among medical professionals and if their mental health had changed before versus during the pandemic. I hypothesized that during the COVID-19 pandemic, it would cause a downfall in medical professionals' mental health. I conducted a survey on SurveyMonkey and received a total of 70 responses. In December of 2019, there was the COVID-19 virus emerged in Wuhan, China. This eventually began to spread around the world and caused a global pandemic. Due to this, hospitalizations began occurring and the hospitals were filled. This caused medical professionals to work longer hours and other extensive measures to help those in dire need of medical assistance. I used a total of 6 research articles to help me in my research. One being anxiety, depression, and functional impairment during the COVID-19 pandemic among healthcare professionals. This article addressed the seriousness of COVID-19 as a highly contagious virus. This article, I was able to see that 20 to 30s age group, females, unmarried professionals, and doctors were more likely to experience depression and anxiety. The purpose of this study is to distinguish whether the majority of healthcare professionals' mental health is affected by the COVID-19 pandemic. My mentor helped me conduct a survey on SurveyMonkey, and I sent it out to local medical professionals. I was able to send it to friends and family that eventually they sent to their friends. I was also able to post it on Facebook, which I got a number of responses for. And I was also able to volunteer at a vaccine drive where I was able to reach out to doctors and nurses helping out that also helped me conduct my survey. I had 2 research questions. 1, which mental illness are healthcare professionals most likely to experience during this COVID-19 pandemic? 2, is there a significant difference of mental illness in healthcare professionals before or during the COVID-19 pandemic? I was able to create 14 charts and graphs, but the most prevalent are these shown on the poster. In figure and table 1, you can see the medical professionals experiencing mental health issues before the pandemic. Here we are able to see that 48.57% were feeling none of the above of the mental health issues listed. 4.29% were feeling quiet or withdrawn. 4.29% had changes in behavior or feelings. 5.71% had emotional outbursts. 0% had substance abuse. Oh, sorry about that. 18.57% had sleep problems. 4.29% had eating disorders. 37.14% were feeling stress. 15.71% had depression or low mood. 22.86% had anxiety or feeling anxious or worried. As we compare it to the figure in table 2, we are able to see a significant difference. 12.86% were feeling none of the above, compared to before the pandemic, where 48.57% were feeling none of the above. 15.71% also increased from 4.29% before the pandemic. 30%, changes in behavior or feelings increased to 30% as opposed to 4.29%. Emotional outburst also increased. It is now at 21.43% as opposed to 5.71%. Substance abuse also increased. It is now at 1.43% as opposed to 0%. Sleep problems also increased. It's now at 38.57% as opposed to 18.57%. Eating disorders also increased. It is now at 7.14% as opposed to 4.29%. Stress also increased. It is now at 71.43% as opposed to 37.14%. Depression or low mood also increased. It is now at 28.57% as opposed to 15.71%. Anxiety or feeling anxious or worried increased, and it is now at 60% as opposed to 22.86%. After reviewing all of these results, I was able to see that stress, anxiety, and sleep problems were the main symptoms that medical professionals were feeling. These results significantly increased from before the pandemic. I gathered data from 70 medical professionals, and I was able to get 61 females and 9 males of various ethnic backgrounds that ranged from 18 to 75 age group, which made the results a reliable trend to follow. I have created this project because I wanted to shed light on a topic that is hardly talked about, and that is our heroes throughout the pandemic that have been sacrificing and helping a lot, and offering a lot of medical assistance to those. I also wanted to educate people on a topic that is hardly talked about, and this is an effort to have people to continue wearing their masks and to take the COVID-19 virus seriously. There were a couple of limitations in my research. I wanted to compare the demographics of different medical professionals, but since Laredo was predominantly Hispanic, the majority of the responses were Hispanic. So I wanted to incorporate different demographics, which I wasn't able to do. I also wanted to get more responses from males because the majority of them were females. And for further research, I want to conduct a research project on how the pandemic has affected young children with having to adjust to online school, and also I wanted to see if it affected their social interactions, having been isolated at such a young age. These are the 6 research articles that I followed throughout my research, and I was able to compare these responses to those responses, and I was able to come up with my research questions while looking at those articles. I would like to thank Dr. Garza, Vice President for Resource Development and External Affairs, Ms. Rosemary Agüero, LEAPS Project Director, Dr. Carranza, my mentor, Yalimar Villarreal, my student mentor, Ms. Solis, Undergraduate Research Coordinator, and Title III LEAPS program for allowing me to do this research project. Thank you.